Howdy, and welcome to Let's Talk Texas, the official podcast of the Texas House Republican Caucus. Sorry, we had a little bit of a break there as things got really busy down here for session. A lot of deadlines that came up, members working hard on the floor to get these important issues passed and across the finish line. We've still got a few more votes going on as conference committee reports come back and all of those details get sorted out. Conference committee reports get adopted and then sent to the governor's office. There are still bills that are coming back from the Senate to the House that either will concur or the authors will request a conference committee to work out the differences. So it's still a fever pitch down here as we work on the bills that are still in action, still going through the process. If you want to learn more about those, you can head to the website, texashousecaucus.com. Click on that news portal at the top. It will give you updates on what we've already got to the governor's desk, what has already been signed by the governor, as well as some of the highlights of what's still making its way. My guest today is Chairman For Price, and if you don't know Chair Price, he's a representative from the Panhandle. He is probably one of the longest-serving leaders on healthcare in the legislature that I personally know of. Former chair of the Public Health Committee, has been leading on this issue a long time, and we start off the episode today talking about HB4, which is still going through the conference committee process. Talk to him about telehealth, telemedicine. What is the difference? What does it mean going forward as we look to get this bill across the finish line? Looking back on where telemedicine started a few sessions ago, as this has been a ongoing conversation in the House, in the legislature, and then how that conversation changed during the pandemic as everyone got a chance to put some real world applicability to this crucial access to healthcare. So had a great time talking to him. I'm talking too much. I'm going to let him tell you all about it. All right, let's talk Texas. It's been a long couple of weeks for the House members on the floor. But before we get into kind of the overall crux of this session, I wanted to talk to you specifically about HB4, telemedicine, telehealth. You're the author of this bill, and it really is something that a lot of folks have been talking about down here for a lot of years. So I guess before we get into the details of the bill, can you take us to some of the background of your experience in talking about telemedicine here in Texas?
Absolutely. Several sessions ago, our office and a lot of folks actually started working on telehealth and telemedicine related issues and policy developments, and touring the state and talking to providers and hospitals and clinics and offices and really just trying to understand how we could implement something that was so beneficial to so many people. Really, the hang up was not the technology piece of it. We've had the technology to deliver services through an audio-visual connection, for a long time. Yeah. The real hang up was coding and reimbursements and payments and money. That really was kind of it was one of those cases where the law hadn't kept up with, the technology. And so a lot of what we were based on, our infrastructure, was just kind of, based on older methods of providing medical services. So several sessions ago, I guess 2 sessions ago, we started to pass some very good telehealth and telemedicine legislation to start to break down those barriers, change the dynamics, make sure providers could provide services and get reimbursed through health plans for those services if they were provided through telehealth or telemedicine technology. And the distinction there, a lot of people don't know, and this is real basic, but telemedicine is provided by an MD, a physician. Telehealth is provided, it's defined as being provided by other allied health professionals.
Okay, so there is a very distinct difference between telehealth and telemedicine.
It's kind of a nuance, but if you hear somebody talking about telemedicine and you hear them talking about telehealth, those really are distinct things in the law. So that's one distinction. But we really did a good job. Several folks in the legislature that are still here worked on that. We passed legislation to really provide, for instance, through last session and the session before, a package of bills that would not allow any discriminatory practices on payment if a physician, for instance, in their independent medical judgment, could provide a service through technological means that they were comfortable providing. You couldn't discriminate against them from doing that for payment purposes any different than if they had provided it in their office. And so that really did break down some barriers. Then we removed platform restrictions and things like that. Last session, Dr. Buckingham and I worked on that. And then this session with House Bill 4, we're expanding. We're really building off of this foundation that was laid the last two sessions to cover now all the different Texans through the Medicaid program, some of the most vulnerable populations in our waiver programs across Texas, some of the most vulnerable people and some of the most in need of those services where it's extremely costly and sometimes ineffective and not very efficient to transport folks to a clinic or a hospital or an FQHC. So that is really what HB4 does. It just kind of rounds out this whole package of bills. It's going to make telehealth and telemedicine more accessible to Texans all over, just in every corner of the state, and really make it more accessible to the folks that I think have been left out in the past. So very excited about that. I got to thank the speaker's team and their office for prioritizing this bill. It's kind of fun that it's HB4. They've got a sense of humor since, obviously that's my name. But the fun part about that has been this is one of those issues that has been broadly supported. And it doesn't matter really what part of the state you live in. Really, it hasn't mattered, where you are on the political spectrum. There's a lot of, attention and recognized need for this. And so for us to take the lead on it has been, really gratifying. And we've had a lot of folks in our corner helping. So
in the kind of the nuts and bolts of how HB4 will work, it opens some new doors in telehealth and telemedicine as well, right?
It does.
Anything new from what we saw take place over the pandemic response? Anything that you guys maybe looked at as people came and testified that is in addition to the services we already saw become widely available in response to the pandemic?
There really are. There's some really easy examples too. I mean, the probably one of the most simple but most effective things that we're addressing in HB4 is something that has been very difficult to navigate in traditional Medicaid circles, which is just communication by email or text. So, for instance, during COVID, it would have been great for all those folks who are participating in the waiver programs or through Medicaid to have been notified, here's your local and closest testing center. Here's where you can go. Mm-hmm. You couldn't do it because there were restrictions, and through multiple commissioners and multiple sessions, no one could agree on forms and authority and just the bureaucratic red tape that goes along with getting something like that into the system. Mm-hmm. So we address that, and so we make it, an authorized practice, and we actually get into the details about, what can be communicated, and just keeping Texans and patients and clients informed about what they can do when. Here's your appointment. Be sure you have a reminder. Get here and. Just everything that you can imagine. So sometimes you take that for granted in business and other places because so much what we do now is by electronic communication. Mm-hmm. But it was, again, kind of bringing some old law, into modern practice. And so that really is something that will make a big difference going forward for just a ton of people. Very simple example, but that's just one of them.
Well, and it's a great example leading into my next question for you, which is, a lot of times if the legislature is reticent to go full in on an idea, they'll create a pilot program, right? A test run of that. And you have seen your fair share of those in your time here in the legislature. And I wanted to ask you specifically, are there many differences between, the traditional pilot program and the paces that telehealth, telemedicine were put through in the pandemic response?
I think possibly there are some distinctions there. It did help everybody, really realize at a very personal level how easy to use and how safe it is to use, especially during a pandemic. So providers and patients alike, the utilization was sky high. Most physicians across the state now have employed some level of telehealth or telemedicine services into their practices. Most patients have taken advantage of that, and so a lot of employers are looking for health plans that make sure that those that are participating in their networks are on the cutting edge, that are making sure that these services and technological opportunities are available. So during the pandemic, it sort of underscored the ease of use, the need, as opposed to 2 sessions ago when we're talking about these issues, folks are kind of thinking, yeah, that sounds important, but so does flood control, and so does, which are important issues. I mean, you just name it. There's so many different things the state of Texas is focused on, and rightfully so. But this really did help sort of align the stars. Everybody said, yeah, okay, we see and understand at a very basic and personal level, especially during the pandemic, how this can be effective and how it can be efficient. We actually give broad latitude in HB4 to the commissioner to start to say, look, if it's clinically effective and cost effective, and there are things that we're not anticipating down the road that this should be utilized for, you've got the authority to go in there and start to develop the rules to utilize it. So we don't want to find ourselves way behind the curve. We know technology is going to change. We know things will advance. We're trying to be as flexible within the bill as possible to accommodate that. But that's a case where, it really did, the stars, I guess, aligned from the standpoint of getting everybody's attention during the pandemic about how useful this actually can be. And whether it's telemonitoring, telehealth, or telemedicine, these are just examples of the way we're going to work in healthcare going forward. It's going to become more common all the time.
Yeah, and it really does amplify that access to care aspect that we continue to try and address session after session here in the legislature. And for you, you represent a district up in the Panhandle, right. And so this is an issue that, access to care is something rural Texans have been talking about for a long time. But now, urban representatives have been really had their eyes open to how it affects their constituents.
Oh, absolutely.
And which dovetails nicely into the last part of this, which is not just addressing, healthcare as we think about it in terms of, you got the sniffles or cold or you need to go get vaccinations, inoculations, whatever, this also opens the door for mental health services, right?
Absolutely.
Chairwoman Click, chair of the Public Health Committee, had mentioned earlier this session on the podcast that teledentistry is something that this opens the door for as well.
Right.
So as you look forward beyond, I don't want to rain on your victory lap just yet, right? We still got to get the bill signed into law, and it is a monumental step forward. But is there anything you're looking at beyond the horizon in terms of telehealth, telemedicine that you think we could be exploring in the interim?
I think we definitely want to keep track of how this utilization is going to be sustained. I know a lot of folks took advantage of it during the pandemic because they didn't want to get out, or offices actually required it, or just from a safety and clinical safety standpoint, that was how a lot of this was utilized. I think that will ebb and flow a little bit as we start to open back up, and certainly we're seeing that already. So I do want to keep, close eye on how successful what we believe is already successful will continue to be. We want to make sure that if there are any unintended consequences of this bill or related bills, that we address that as well. A couple of sessions ago, you talked about a pilot a minute ago. One thing that we sort of connected through telehealth services was a cooperative relationship that we funded through appropriations that for NICUs in specialty children's hospitals. So, for instance, I visited Children's Hospital in Dallas, and they had contracted with a bunch of rural hospitals throughout the state of Texas so that, at a moment's notice on call, if they had a NICU situation, a pediatric emergency that they weren't equipped to deal with, and the nearest hospital was going to be hours away or airlift ambulance right away, which is very, very expensive, and the whole family's going to have to go. There are plenty of cases where they can connect quickly to specialists who are well trained and equipped to walk another physician through the paces of stabilizing that patient where they might not need a transfer. And those relationships have worked out really well, and it's prevented millions of dollars from being spent unnecessarily. It's prevented families from having to travel, the stress and just the delay in care. And that's the kind of thing that if we can continue to build out the infrastructure for networks like that to hospitals, different levels of hospitals all across the state, it's going to help patient care, significantly, access to care, which you mentioned significantly. It's also going to help save some of these smaller, struggling hospitals in communities that they just don't have, a level 3 or a level 2 hospital. They've got a level 4, and that's really going to be important for us going forward. We need to do everything we can to keep their doors open. That hospitals in rural communities are very, very important. And then just the last thing I'll say on this is when you mentioned, it's important in urban Texas and rural Texas, it really is because for obvious reasons, rural Texas, that access to care is a huge, huge issue. And so telehealth and telemedicine really makes a big difference there. If here in the state's capital, Austin, Texas, or you live in Harris County in Houston or around Houston, or you live in, the Metroplex, I mean, you can spend 2 hours in your car going to an appointment that is literally 15 miles away, or just on the other side of town. And if you can avoid that, that's significant, and it saves time. It's efficient. It's great. You don't have to take half a day's off, work and all that. So, it really helps folks that live in concentrated urban areas. It helps folks maybe for different reasons in a rural part of the state. But we're going to see these kind of relationships grow. I'm going to keep an eye on those kind of opportunities. I think it's just a very dynamic and ever-changing field. That's why we're trying to be as flexible as we can in the actual text of the statute, so that if we need to come back and adjust, we can. But we don't want to. We don't have to create the wheel or the whole program every now and then. So I think we're in really good shape and laying a super foundation going forward.
Well, it obviously is one of the landmark bills of the session. It is something that Texans have gotten a lot of experience with over the last year and a half now, and so I know a lot of folks in the medical community are grateful to see this finally moving forward. But you also have some other things you're doing while you're down here. You're not just working on telehealth, telemedicine. So for your folks back home, what are some of the other bills you've been working on? What looks like it's either on the governor's desk or headed that direction?
Well, thanks for asking. It's always fun to talk about those too. This session and several sessions prior to this, one of the areas that I've spent a lot of time has been in the behavioral and mental health area, just trying to develop policies and modernize some of our laws and provide better access. This session, several bills are either on the governor's desk or on their way to the governor's desk that I've authored or co-authored or joint authored that have really improved again, I think what we're doing in that area, to provide, for instance, we several sessions ago provided parity so that insurance companies couldn't discriminate against folks within their plans. If they covered mental health services, for instance, they couldn't require prior authorizations for that if they weren't requiring it for physical health visits or things of that nature. You couldn't charge different copays, for instance, stuff like that. You had to treat everything on a level playing field with parity. And so we passed that, but folks don't often know how to navigate that. If they've got a complaint, where do they go? How does that work? So last night the Senate passed 2595 as a House bill that it creates a ombudsman and a portal, a place where you can actually contact folks at the Department of Insurance. You can get training about what that means and how that functions, and so you can actually, take advantage of the good laws that we passed if you've got some problems or you think you're encountering some friction that you shouldn't, and that's consumer friendly. It's helpful. It actually helps us implement the laws that we've passed previously in a better way. happy about that. I've worked with Chairman Leach to incorporate some language on a kind of an omnibus criminal justice related bill that my district attorneys back home have wanted to see.
Real quick, going back to the ombudsman for that access on healthcare related stuff, is that going to be under HHSC or
TDI?
TDI,
Yeah,
okay.
the Department of Insurance, and so that's where that'll be located. And they've worked real hard with us too. And I mean, my hat's off to them because a lot of this is brand new. A lot of these agencies and departments have to implement and deal with the laws that the legislature passes, and they've been really good to work with here on this issue. So I'm happy about that. But we've got a lot of good things happening in the healthcare world, the mental health and behavioral health world. Again, some flexibility built into our courts locally in the district that I represent. Just allowing some specialty courts to develop in a more robust way, in a more flexible way up there. And for those folks that don't know what those are, those are the like veterans courts or drug courts, things that we have typically been funding through a variety of sources, but have been tremendously successful. And so building some flexibility in there so regional counties can participate. Maybe not one county on their own could do it, but when they band together and have the ability to have a jurisdiction over some of these areas, it really helps areas like mine that are less populated. So
or maybe split across two
multiple
counties.
That's right. So those are just a couple of things that I think are worth mentioning today, because very excited. Those have everyday real impacts on the lives of the folks that we represent, and those are kitchen table issues. They're just very, very successful, and I'm glad that they're passing.
Well, you looking forward to going home?
Oh, very much. Yeah, I can't wait till the session concludes. It's been a successful session, a good session. A lot of the goals that we discussed, even you and I discussed months ago, that at those stages are ideas and objectives are now becoming reality, and so it's a great feeling to kind of get to the finish line and cross the tape, and I think we'll all be real proud of the accomplishments here when we sine die next Monday.
Yeah. For you, as you look back on this session, how does it really compare to the previous ones, and does it rank up there as one of the more difficult, or are you impressed at how much you were able to achieve despite I would venture to say there were a lot of people unsure at the beginning of the session how things were going to go.
Well, they all have a life of their own. They're unique in their own individual ways. Every 2 years, there's different priorities, different personalities and people and goals, and just everything seems to be so different from one session to the next. But as we entered this session in the middle of a pandemic with a financial outlook that was less than rosy, with a lot of uncertainty, I would say where we are today is just phenomenal, because where we are financially is strong, and we're about to pass a good, solid, balanced, responsible budget that addresses the state's needs. And 6 months ago, a year ago, a lot of folks would question whether or not we would be where we are today in that respect. And then I think we also have really good objectives, and of course, that are being satisfied and goals reached. You always end up at a session where you think, gosh, I wish this, that, or the other could have been accomplished too, but it always means you've got, that interim work, and you come back and you pick up where you left off, and sometimes, there's a lot of unexpected things that happen, whether it's natural disasters or technological advances. Things happen, daily, and it's dynamic, and that's what makes being in the legislature so much fun is, it's interesting work. You get to see the changing landscape every day and address the needs as they arise, and this has been a good session. I think it's been very successful in many respects, and where we thought we might be and where we are two very different things, and I'm proud of where we are.
Well, and I think Texans really, as they look at this, and we have the budget discussion coming down today, should be grateful for the conservative policies that have been put in place to allow Texas to, continue on. Obviously, everyone struggled in some form or fashion, but the comptroller's updated BRE showing that the impact to the state and its economy was drastically less than what we initially thought.
We're still the envy of the other 49 states. I mean, when you look at job creation still, you look at economic activity, and you look at, the revenue that the state is generating, and just the foundation for a friendly business climate. These are all things that never happened by accident to begin with, but we are well positioned now for, the next biennium and beyond. And, while not everybody's always going to agree on every issue, of course, it's still very exciting that Texas remains so well positioned and is, so integral to the national security and the food and fiber and just the energy production and all the things that the entire country really looks to and depends on. We are in a really good spot to continue leading the whole country. So I'm excited about the future.
Well, we're going to let you get out of here because you still got some votes on the floor. You got to take care of some conference committees and things like that. But before you do, I just want to thank you, Chair Price, for taking time to sit down with the podcast, but also for years, you, former Chair of Public Health, have been helping Republicans lead on the issue of healthcare. This session, continue on the work with Dr. Oliverson, Chairman Frank, Chairman Stephanie Click, so many of the Republican leaders in the Texas House putting the best foot forward and attacking not only the telehealth, telemedicine, but also surprise medical billing, more transparency, the prescription drug program stuff that we were getting past this session, and all those details are worked out. So just thank you sincerely for being a leader on this specific issue for Texas.
I really appreciate it. Thank you very much.
All right, well, we'll let you get back to the floor, and then Monday's coming, and you get to go home.
Sounds good. Thank you.
Thank you. All right, thank you again to Chairman Price for joining us. Thank you to you, as always, for tuning in. These podcasts are a great way for us to sit down with a member, talk about issues, talk about the bills they're working on. But obviously, session is coming to an end. So if you've missed any of these episodes, first and foremost, where have you been all session? 140 days have almost gone by and you haven't heard one episode? Got a way to fix it. Head over to our YouTube channel or Facebook page, facebook.com/TXGOP Caucus. You can find all of the podcast episodes there, or you can go to our website, texashousecaucus.com/Let's Talk Texas. Or you can find it from the homepage. You can also head to Apple, iTunes, Spotify, wherever you get your podcasts. You'll probably be able to find the audio version there. We are going to try to continue these conversations. We haven't figured out the details yet. Maybe we'll do it remotely. Maybe members, as they come down to work during the interim, fingers crossed, we'll get to take the podcast on the road and go visit the districts and talk Texas out in the 254 counties that make up this great state. So if you want to update, again, said at the top of the show, if you want to find out where we are, we've got some news alert updates on our website. That's texashousecaucus.com. You can find the news link at the top, as well as articles right there on the homepage. And as always, make sure you're following us on social media, Facebook, Twitter, Instagram, at TXGOP Caucus. Best way to find us and keep up to date on everything that's happening here in the Texas House of Representatives. Until next time, y'all have a good one.